Painkillers in bodybuilding, the silent crutch behind the muscles. Introduction. When people think of bodybuilding drugs, they imagine steroids, growth hormone, insulin, or stimulants like clenbuterol and Adderall. But one category rarely gets talked about: painkillers. Behind the stage smiles and shredded physiques, many competitors are quietly depending on pain medication to push through training, to survive contest prep, and sometimes just to cope with daily pain. In this video, we'll explore why painkillers are used in bodybuilding, the most common types, how they affect performance and health, the risks nobody talks about, why bodybuilders use painkillers. Chronic pain from training. Heavy lifting equals constant stress on joints, tendons, and muscles. Shoulder, knee, and back pain are almost universal at elite levels. Painkillers allow athletes to train through injuries instead of resting. Contest prep survival. During prep, body fat is ultra low, leads to less cushioning on joints, which means pain increases. Sleep is often poor. Energy is low, mood crashes. Painkillers become a coping mechanism. Masking injuries. Instead of taking months off for recovery, painkillers hide the pain, letting athletes keep lifting despite serious injuries. This is one reason many pros suffer career-ending tears, pecs, biceps, and quads. Mental escape. Some painkillers give euphoria, sedation, or relaxation. For athletes under pressure, they become not just physical relief, but emotional relief. Types of painkillers in bodybuilding. 1. NSAIDs, non-steroidal anti-inflammatory drugs. Examples: ibuprofen, naproxen, diclofenac. Widely used for muscle soreness, tendon pain, and joint inflammation. Risks: long-term use damages the stomach lining, kidneys, and heart. 2. Opioids. Examples: tramadol, oxycodone, hydrocodone, morphine. Used for severe pain from injuries or surgery. Risks: addiction, tolerance, hormonal suppression, overdose. Tramadol is especially seen in bodybuilding because it also affects serotonin and norepinephrine, mood boost. Prescription strength pain relievers. Celecoxib, COX-2 inhibitors, muscle relaxants like carisoprodol. Sometimes used when NSAIDs stop lurking. Risks: heart issues, sedation, dependence. Over-the-counter pain hacks. Aspirin, sometimes used for blood thinning plus pain. Acetaminophen, paracetamol. Liver damage if combined with alcohol or oral steroids, which are already liver toxic. Risks of painkiller use in bodybuilding. Masking real damage. Training through pain makes small tears big ruptures. Career-ending injuries often trace back to lifting on painkillers. Kidney and liver stress. NSAIDs plus dehydration from contest prep equals kidney failure. Paracetamol plus oral steroids equals liver toxicity. Hormonal suppression. Chronic opioids lower testosterone, opposite of what a bodybuilder wants. Addiction cycle. Many start using painkillers for injuries, end up needing them just to feel normal. Cardiovascular risk. Both NSAIDs and opioids increase heart strain, especially dangerous in a sport where steroid use already increases heart risks. How they're used in practice. NSAIDs daily or before heavy training sessions. Tramadol. Some use pre-workout for pain and mood lift, others at night for sleep. Oxycodone or hydrocodone, more often after surgery or severe injury, but abuse exists. Acetaminophen, stacked with caffeine pre-workout, but very hard on the liver. The dark side, why it's dangerous. Painkillers don't heal injuries, they just hide them. They lead to a cycle of overtraining, more injuries, more drugs. Combined with steroids, stimulants, and diuretics, painkillers add another layer of organ stress and sudden death risk. Conclusion: painkillers in bodybuilding are a hidden epidemic. They help athletes train harder, compete through pain, and appear unstoppable. But they also destroy joints, livers, kidneys, hormones, and lives. At the end of the day, bodybuilding should be about building strength, discipline, and health, not hiding injuries with dangerous drugs.